Good afternoon, Kahnawà. Welcome to another update from public safety and public health. Today will be a fairly brief show, but I just wanted to provide some pertinent information to the community since last week. But I'll start off with some cases. I know a lot of people are always interested in the number of active cases in the community, and as of we speak, at this moment there are 32 active cases, and that's 13 new ones since last Friday. That's a total of 89 cases since the fourth wave began. Total cases of people with 2 doses has been 7, and people who've been COVID positive with 1 dose of the vaccine has been 1. So 8 people out of the 89 were either vaccinated or partially vaccinated. So still the vast majority of the people being infected, unfortunately, are the ones who are unvaccinated. So this is still a very high daily rate in our community. Thus, we remain at a red level alert in the community for the risk of the transmission of the virus. And as we introduced last week, and it is posted at the 911 site on the web, the new way of determining the green, yellow, and red do not refer back to the old charts in which we did for the first 3 waves on measures and closures and stuff relating to colors. Now we want to use colors in the terms of green, yellow, and red in terms of level of risk to the community. And right now we are at the red level risk, so the risk of transmission is high as we currently speak. So please remain vigilant, remain careful, and take those extra measures as appropriate. Obviously, this week has been a very trying week for public safety and public health. We all know of recent events. But I also want to take the opportunity to thank the many people who have personally or privately lend their support to public safety and public health, and acknowledging the work that we do, and acknowledging the fact that they do support safety measures in our community. So I'd like to thank those people who have reached out. I just want to remind the community as well, we do have some guiding principles in which we established at the beginning of the fourth wave that help guide the decisions that need to be made and the recommendations that need to be made to the community. And obviously our first goal since the beginning is always to save lives and protect the most vulnerable people in the population. But also now it's about minimizing the impacts on mental health for Kahnawà. It's about maintaining the economy. It's about not closing down jobs or businesses. That's something we want to do our darnest not to go down that path. So a guiding principle is to maintain economy. We want to protect our frontline workers. We want to protect the hospitals. And we also want to use as minimal measures as possible to achieve the goals. And one of the big goals also is to make sure our children have opportunity to have educational services on site, as well as recreational activities, which they also need for their own well-being. With everything we do, there is a level of risk, but we're trying our best to mitigate the risk so that life could continue, and these guiding principles will remain active and effect, so that we could see a way forward, a path forward over the next while during the fourth wave of the pandemic. So we're doing what we can. We're working in collaboration with the Education Center and other institutions to ensure that the latest public health information is relayed properly, and that it does get implemented in a way that is as safe as possible. So public health and public safety, we are still committed to doing what we need to do to continue to protect our community, and we will provide updates again as required to do so. Maybe on a final note, I just want to make mention that the proof of vaccination has came into effect last week. And it does impact 27 locations within Kahnawà, which include social clubs and also the sports complex. It did roll out smoothly with overwhelming support from the businesses impacted, as they understand it is a vital component to keeping the economy rolling and keeping people employed. So it did roll out very smoothly. There was some questions and that we need to clarify and such, but I'm pleased to report to the community that it has been done successfully. And again, it's one piece of a larger puzzle that will help keep our community safe during this fourth wave. So for today, I will leave it there. I just wanted to reassure the community that we're still in the job. We're still doing what we need to do to keep our community safe, and working together as a community, we'll get there. Nyamagawa.